Assalamu alaikum. I'm Dr. Drsaimakhan and we will be discussing hernias today. Hernia is an abnormal protrusion in the interior abdominal wall. Hernia occurs when an organ or tissue pushes through a weak opening or hole through a muscle or tissue which normally contains it. We will be discussing different topics in hernias like different types of hernias, its symptoms, how do we manage it, its treatment, and its presentation. Different types of hernias. What are different types of abdominal hernias? Hiatus hernia, umbilical hernia, paraumbilical hernia, ventral wall hernia, femoral hernia, inguinal hernia. All these hernias occurs in male and females both. Inguinal hernia is exclusively seen in male patients. In infants, normally we see congenital hernias also, which are normally managed within time. Now, how do hernias present themselves? Normally, we see a bulge in the interior abdominal wall, and because it does not bother the patient, so at times it is neglected for a long period. I would suggest that as soon as you're aware of a hernia in the wall, abdominal wall, you should manage it immediately. It presents normally without pain. There is a dragging feeling of heaviness, slight discomfort. In cases of obstruction, when this protrusion starts losing its blood supply from the abdomen, it causes pain and it presents as an inflammatory lesion with redness around it, and patient presents in emergency with extreme pain and it has to be treated immediately. The risk factors or the factors which normally cause hernias are lifting heavy objects, doing heavy exercises, chronic cough, chronic constipation. It also is seen in chronic smokers and in obese patients. So make sure that if you have hernia and you are presenting with all these symptoms, act accordingly and treat it timely. Now, how do we manage it? Treatment is only and only surgery. There are two types of treatments in hernia. First one is the conventional open surgery, in which mesh is placed in the area of incision. Second is a better way of treatment, in which there is laparoscopic surgery. Small incisions are made and the area of hernia is treated. This is a better way of treatment. It has excellent results. Small incisions are given, which are cosmetically more appreciable by the patients, less bleeding, quick recovery time, and normally patients resume their work within a day or two. And normally this does not have any side effects. So please treat your hernias in time before they get obstructed or before they increase in size and may start causing problems. Thank you so much. Jazakallah khair.